Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj. Welcome to the podcast. My name is Dr. Noor Gajraj. We have Ross Pelton back today. He is the natural pharmacist. He is also a clinical nutritionist, health educator, and author of 13 books. He's been named one of the top 50 most influential pharmacists in America by American Druggist magazine for his work in natural medicine. His last book is titled Rapamycin, mTOR, Autophagy, and Treating mTOR Syndrome. Today we're going to talk about metabolic health and a product, NTFactoLipids. So thanks very much, Ross, and over to you.
Okay, Norm, thanks for giving me the opportunity to spend some time with you and your viewing audience today. My topic today is a topic and a product that I'm really excited about.
Mhm.
As the name of the brand is NTFactor Lipids, and it actually repairs and replaces and renews mitochondrial membranes. And actually, it renews membranes throughout your entire body, but I spend most of my time focusing on the mitochondrial membrane. And of course, mitochondria, our energy is produced at the cellular level. So when you improve and renew these mitochondrial membranes, you get increases in ATP cellular energy production. This is a slide that's just showing some of the different products that this company, Nutritional Therapeutics, has available. And the main compound or product in their product line is this NTFactor lipids. And I'll go through and explain what that is and what it means. So, this line of products, NTFactor lipids, contain healthy, non-oxidized phospholipids. And that's important because phospholipids are really the basic architectural structure of cell walls and cell membranes throughout your body. So, these products restore the structure and the function of your cellular and your mitochondrial membranes throughout your body. And in terms of mitochondria, when you improve the mitochondrial membrane, you're increasing your ability to produce mitochondrial ATP energy. And in doing so, you're really slowing down the process of biological aging because there's a whole theory of aging, the mitochondrial theory of aging, that talks about biological aging being associated with loss of membrane and mitochondrial energy production. So I do a little analogy here. Lumber is the structure of houses, and over time, the lumber can undergo structural damage, water damage, and termites and so forth. And so over time, the structure can get damaged. Well,
Mhm.
it's the same thing with our cellular membranes throughout the body. Phospholipids provide the structure in cellular and mitochondrial membranes, similar to my analogy of 2x4s and 2x6s being the structure for houses. And here's an image of mitochondrial membranes. And over on the right-hand side here, you can see I'm showing the phospholipid barrier or bilayer. All of this kind of brownish area, these are the phospholipids that perform or create the architectural structure of cell walls and cell membranes throughout your body. There's a lot of different things embedded in these cellular membranes, proteins and cholesterol and ion channels and so forth, but it's the phospholipids that are the structure of your cellular membranes. And over time, they can get damaged and then they don't work so well. So here's an image of a mitochondria, and this is where our energy is produced. And you have an outer and an inner cellular membrane in the mitochondria, and over time, these get oxidized and have damage to them. I want to just emphasize how many mitochondria we have in our bodies. The human body's got about 37 trillion cells. The average cell has 1 to 2,000 mitochondria per cell. And the heart muscle, which is the most energy demanding muscle in the body, has anywhere from 5,000 to 8,000 mitochondria per cell. So you've got an enormous number of mitochondria in your body, and they suggest that about 10% of our human body weight is the cumulative weight of the mitochondria in all the cells in our body. So I mentioned the mitochondrial theory of aging. This is when you, over time, get free radical oxidative stress and damage to the mitochondrial membranes and the mitochondrial DNA. And this creates a decline in your ability to produce energy. So this decline in mitochondrial function and the decline in the production of ATP energy at the cellular level are one of the primary hallmarks of biological aging. And so NT-factor lipids is actually repairing and restoring mitochondrial membrane function. And in clinical trials, they show compared to placebo controls, you're slowing down the rate of DNA damage with NT-factor lipids. So you're actually slowing the biological aging process and increasing your ability to produce mitochondrial energy. Many people as they age say, whoa, I just don't have as much energy as I used to. That's because you've got continual cumulative damage happening to your mitochondria. So this is a slide just emphasizing that you have an outer membrane in your mitochondria and an inner membrane in the mitochondria, and all these membranes can accumulate oxidative free radical damage over time. I'm a science-based guy, and so there's a tremendous amount of science that's been published on NT-factor lipids. Over 60 published articles, many of them peer-reviewed scientific articles and clinical trials, and there's just enormous amount of science supporting this. And I want to emphasize there is no other product in the world that's doing what NT-factor lipids does, the renewal and replacement of mitochondrial membranes. This particular slide is documenting the improvement of mitochondrial energy supply with NT-factor lipids. In the beginning of this clinical trial, aged people about average 69.5 years of age. This is showing their mitochondrial energy production before the clinical trial, which is below normal. And after 8 weeks of treatment, their mitochondrial energy production has increased to the level that's equivalent to healthy 30-year-old individuals. So you really do get substantial, measurable increases in energy production and improvement in your mitochondrial function when you're taking NT-factor lipids over a period of time, this being an 8-week clinical trial. On this slide, I'm showing that in your mitochondrial membranes that are damaged, you start having leakage of electrons, which produce free radical damage. And when you take NT-factor lipids, the body incorporates these new phospholipids into the cellular membrane and restores and repairs the mitochondrial membrane. And note about mTOR and autophagy, where mTOR is the driving energy force for building new cells. Autophagy is the other side of the coin. When there's no nutrients coming into cells, autophagy is the primary detoxification and rebuilding process of your body. You're going to accomplish better autophagy, better rebuilding of your body when you're taking NT-factor lipids. This slide is a really important slide talking about a dye that is used in the scientific industry, pharmaceutical industry a lot. It's a fluorescent dye. It's called rhodamine dye, and it gives a green phosphorescent color. In these cells here, treated with the rhodamine dye, this is a damaged cell over time. The mitochondria are damaged, so they're not able to produce energy or adequate amounts of energy. So they can't take up the rhodamine dye effectively and get green phosphorescence. After a subject has been on NT-factor lipids for a period of time, they do the follow-up study with the rhodamine dye, and you can see there's a tremendous amount of green phosphorescence, which means the mitochondrial membrane have improved their function. They're able to produce energy and they can take up the rhodamine dye. And so this is a visual representation that NT-factor lipids is actually resulting in improved mitochondrial function. And here we're just showing the physical cells, a damaged cell where over time it has not been treated with NT-factor lipids. At the same time, cells treated with NT-factor lipids undergo far less damage. When your cellular membranes function better, you more efficiently transfer nutrients across the cellular membrane into the cell. So everything starts to work better. So NT-factor lipids increases the absorption of other nutrients, and NT-factor lipids actually has Nutritional Therapeutics, the company, has a product that is a combination of NT-factor lipids with coenzyme Q10. It more than doubles the absorption of CoQ10 when it's combined with NT-factor lipids. So again, just emphasizing when you improve the function of your cellular membranes, you're going to get the absorption of many difficult to absorb nutrients, increasing the absorption into the cells. So things also like curcumin and quercetin, which are hard flavonoids to absorb. You get better absorption of these when you're taking NT-factor lipids. This is a study on people with severe fatigue using a vitamin complex along with NT-factor lipids. At day zero, they're measuring the level of fatigue in these people that had severe fatigue. After 30 days, tremendous significant reduction in fatigue. And after 60 days, another big decrease in fatigue. So improving mitochondrial function and increasing the production of cellular ATP, people really get significant declines in fatigue, more stamina, more energy, really noticeable. This is a slide that's looking at a number of different studies. This is with 70-year-old people, 35.5 reduction in fatigue. The Piper fatigue scale is a commonly used scale to measure fatigue. And study with people with just general fatigue, 50.3 is their average age of the people in this clinical trial, 40.5% reduction in fatigue. Here, chronic fatigue and fibromyalgia patients, 44.8 years is the average age of these people, 43.1% reduction in fatigue. And in the general population, 57, the average age, 37% reduction in fatigue in just 1 week. So we really have solid documentation that this product is repairing and renewing mitochondrial membranes, resulting in increased energy production. And these are some other data points on the Piper fatigue scale. People get significant increases in cognitive mood, in behavior, affective meaning, sensory things like smell and hearing are improved. Overall fatigue levels substantially reduced. Based on some of the clinical trials, we're actually improving mental clarity and cognitive function. Increases in fatigue, mental clarity, increased ability to concentrate. So improving the cellular membranes throughout your body, it's not just the skin and the liver, it's your brain that is starting to improve function. Here's a study with the results combining NT-factor lipids with a vitamin B complex. And on the left-hand image here, we're measuring homocysteine. And this is, again, a 6-month clinical trial. After 6 months, about a 32% reduction in homocysteine levels. And on the right-hand image here, after 6 months, lowering fasting insulin levels by 59%. So lowering homocysteine 32% and lowering fasting insulin levels 59%. These are huge clinical outcomes, reducing cardiovascular risk and, of course, fasting insulin levels going down. You're reducing a lot of risks of many different things in the body. This slide, I'm emphasizing a scientist by the name of Garth Nicholson, who's a chief scientific officer for the company Nutritional Therapeutic. And this guy is an amazing scientist. He's one of the world's leading authorities on cellular medicine. He's got over 690 scientific medical publications, 9 patents. He was nominated for the Nobel Prize back in the 1970s. He's got over 40 publications on NT-factor lipids. We're really happy to have him on board as our scientific advisor. There's a big problem globally on declining fertility rates. And so they've done some studies with NT-factor lipids and shown that they protect male sperm from oxidative damage and end up getting increases in the function of the male sperm. So we're hopeful there's some studies down in South America being done now, hoping we can actually document improved fertility with women that are taking NT-factor lipids. And this slide is just showing how NT-factor lipids protect sperm. Here's sperm exposed to a little hydrogen peroxide, and it damages the sperm. Here's the same sperm exposed to the hydrogen peroxide, but also protected with a 0.1% solution of the phospholipids. And you see you've got the fluorescent green showing that the cells are protected and they're working better. So definitely protecting male sperm. And they've shown this in humans and also in several different animal models. So summarizing the cardiovascular benefits from NT-factor lipids, it's improving cardiovascular function because the heart is the most energy demanding muscle in the body. And when you increase the ability of the heart muscles and the mitochondria in the heart to produce energy, you're improving cardiovascular function, reducing oxidative stress and free radical damage, and actually you're improving cardiovascular function, so you're decreasing the risk from cardiovascular diseases. And what we found in some of the studies is that NT-factor lipids is also helping to improve detoxification. Many of the toxins that the body stores are fat-soluble toxins, and when you take the NT-factor lipids, we found that these hydrophobic toxins are actually sequestered into the phospholipid droplets and excreted into the intestinal tract for elimination through bowel movements. Here's one of the most important studies we've done. This is NT-factor lipids with Gulf War veterans. Garth Nicholson was really concerned about the health of Gulf War veterans. So he recruited a number of these Gulf War veterans whose health had literally been destroyed by exposure to chemical and biological and environmental toxins during their tour of duty in the Gulf War. And here's the results from that study. They measured 22 different areas. All participants suffered multiple health problems and long-term rehabilitation. They took 6 grams of NT-factor lipid daily for 6 months. When they started out, they were using a much smaller dose. Initial recommended dose for NT-factor lipids is 1/8 of a teaspoon. So 6 grams is a little more than a teaspoon. That's a tremendous increase in the dosage level. They started to get really substantial benefits. And the way they measured the health improvements in these Gulf War veterans is called the symptom severity form. There's 22 different categories of symptoms. You see all the different symptoms listed below here. The Gulf War veterans would rate their symptoms anywhere from 0 to 10, and they recorded their symptoms at 2 weeks after they started taking the NT-factor lipids, 1 month later, 3 months later, and 6 months later. So they got major improvements in all of these areas within 6 months. Many of the improvements starting at about 2 or 3 months. So this is just a quick summary of all the things that occur with NT-factor lipids. You're reducing mitochondrial DNA damage, slowing biological aging, improving your mitochondrial function, slowing down the age-related loss of cellular function throughout the body, reducing fatigue, gradual sustained increases in energy. People feel more youthful, much more vitality, and it's actually protecting nerves and nerve function over time. A couple of studies on the nerves in the ear and hearing function showing that NT-factor lipids is protecting nerve function, increases in mental clarity and focus, superior antioxidant activity, and overall, you're improving the quality of life. When you start taking NT-factor lipids, every single cell in your body starts to function better, and over time, many things start to improve. So this again is their product line, non-GMO, no sugar, no herbs and stimulants, good labor practice manufacturing, the Halal certification. So this is just a quick run through of the products. They've got many different products. This is just a few that I like. I take the NT-factor lipids bulk powder here on a regular basis. This is their vitamin complex formula. This is their cellular aging, and it's a really nice chewable wafer that is easy to take. I take it when I travel. Here's the product in their combination with CoQ10 that actually doubles the absorption of CoQ10. CoQ10 is the most important nutrient for your cardiovascular system because the most energy that we use is in the heart muscle, and the most free radicals that we ever get exposed to are produced in the mitochondria during energy production. So CoQ10 is a critical antioxidant nutrient that's also required for several different steps in the electron transport chain in the mitochondria for the production of energy. So I call CoQ10 my number one heart nutrient. With NT-factor lipids, you double the absorption of CoQ10. Here's a vitamin K2 and D3 combination, alpha-ketoglutarate, L-carnitine, L-tartrate, and tyrosine combination. And nutritional therapeutics is also a great lover of pets, and so they have a pet power product. And I give a little bit of NT-factor powder in my cat's wet food every evening in her cat bowl. A number of different ways you can use these products. I will put the NT-factor lipids powder in a smoothie. Some people put it in a coffee. It's acid stable. And they've also got capsules, chewable wafers, and they've got nutrition bars. So a number of different products they have. And this slide is just summarizing the potential of this product to decrease health problems globally. Fibromyalgia is expected to reach $1 billion per year. And fibromyalgia people have difficulty with energy. Chronic fatigue, another situation where people complain about low levels of energy. Huge money market here, $18 to $51 billion per year spent on chronic fatigue. The global fertility market is a huge market. Pain relieving market is a multi-billion dollar market. So NT-factor lipids has a really potential to impact these markets a lot. So this is an exclusive product. No other product does this. I mentioned this, improving quality of life, slowing down biological aging. And it's not just about life extension, it's improving your health level. And so that's the summary of this product. And I want to mention here, this is their website. And if you go to ntfactor.com/research, all the research on this product is available. Every single study is listed. There's a hyperlink for every study, so you can click on the hyperlink and have access to the full study. So this is the science that supports this product. So thanks for your time. And if you are interested, contact NT-Factor Lipids or Nutritional Therapeutics for placing orders. Thanks very much.
Oh, that's wonderful. So, yeah, I think there's going to be a lot more emphasis on mitochondrial health. There's a book by Casey Means called Good Energy. Have you come across that?
I'm not. I haven't.
Yeah.
Or
Her main thrust is that a lot of chronic diseases are the result of mitochondrial dysfunction. And,
yeah.
like you say, targeting mitochondria is going to have multiple effects
Uh-huh.
because of say that mitochondria are at the top of the chain there, and I see that they not only involved in energy production, but they control cell death. They produce hormones and neurotransmitters,
Yeah.
serotonin and melatonin. They're a storage tank for calcium. So yeah, I think that was an excellent presentation. I see that it's available on Amazon. The reviews are very positive. People have a big boost in energy. So I think the science is behind it, and I would recommend that people try it. And, the proof is always in the pudding, I think. All right. Well, thank you very much. I mean, I
Thanks.
really appreciate that
Good
because,
seeing you again, and thanks for the opportunity to share this information with your viewers.
yeah, I think it's going to be very, very useful. Please subscribe to my channel and read my new book, 100 Pathways to Longevity. Add 25 years to your life, available on Amazon.